Hey everyone, if you are watching this recording via YouTube, we have yet to go live in front of our studio audience and we've yet to press record for everyone else. You are behind the scenes with our illustrious panel. We're going to go live and press record in just 15 seconds. All right, guys, ladies, we don't have Marketa here. Is Marketa here?
No.
Not that I see.
All right, Sherry, get on that.
Oh,
Get on that. Why don't you find her and hopefully she'll get here. If not, we've got plenty of content here. I'm not concerned.
I'm sure she'll.
All right, here we go. Let's do this. Have fun out there, everyone. Greetings, everyone. This is Eric Glazer, and welcome to our live recording of Bright Spots in Healthcare, produced by Shared Purpose Connect. We bring leaders together to not only inform our audience, but also unearth bright spots, successes at health plans, hospital systems, and other healthcare-related organizations around the country. Our goal is to identify as many bright spots as possible so that you can determine if the ideas shared on this episode can be applied at your organization. We believe that this approach of finding a bright spot and cloning it is the most effective strategy to improving healthcare in our lifetime. I am super excited and stoked about today's episode. We're going to talk about activating today's Medicare member. We're going to focus on bright spots around effective engagement initiatives and strategies. We have an incredible group around our virtual roundtable today. Bob Crawford is the Vice President of Corporate Marketing and Customer Experience at Blue Cross Blue Shield of Michigan. Dr. Marketa Wills is the Chief Medical Officer at Johns Hopkins Healthcare. Mo Jackson is the Medicare Sales Strategy Manager at Blue KC. And Nathan Adams is the CEO and President of Linkwell Health. For those who are joining us for the first time and you want to make sure you don't miss an episode of Bright Spots in Healthcare, which we typically record live on Thursdays, and you want to get them dropped onto your phone or your tablet, right now, grab your phone, find your favorite podcast app, Spotify, Apple Podcasts, Google Play, whatever you use, Amazon, Stitcher, type in Bright Spots in Healthcare and click subscribe, and you'll get all those episodes and an archive of all the episodes we've covered over the last 18 months. And there's some great guests with great content. I highly encourage you to subscribe to the show. I want to, our aforementioned Linkwell Health, I want to give a quick shout out to them. They are the latest addition to our incredible group of partners for the Bright Spots in Healthcare podcast. If you have not heard of Linkwell Health, they are the only digital content marketing and consumer engagement company exclusively focused on healthcare, and they help clients connect and empower. They help clients connect with your consumers, your members, to take control of their health. You can learn more about them at linkwellhealth.com. I'm going to actually tell you a little bit more about them later on in the show. So welcome to our family, Nathan and the Linkwell Health folks.
Thank you.
I appreciate it. You guys
Happy
being
to
part
be
of
a
it.
sponsor.
So let's get started. One more PSA. Sorry, folks. If you're attending live and you want to help co-moderate with me, use the Q&A module. I got my entire production team here monitoring it. We will, as those of you know who attend these regularly, I'm able to get sometimes as much as, half dozen or more questions integrated into the conversation, depending on how things go with our timing today. So submit your questions through the Q&A. We'll be looking at each and every one of them and incorporate that into the conversation if we don't already plan on asking that question to our roundtable experts. Let us start here with some basic blocking and tackling. Often when we are talking about bright spots in engagement and marketing, we're thinking around a new idea. Maybe it's incentivizing communications or going to like where the member lives and where they are. But if we're truly going to be a more trusted partner to our member and a more effective in communicating to them, we probably need to get better at the fundamentals, the blocking and tackling, right? So Bob Crawford, Vice President, Corporate Marketing, Blue Cross Blue Shield of Michigan, for one more time. How do you guys in Michigan approach marketing and approach the member?
I couldn't agree more, Eric. Thanks for asking the question. I do believe there's a lot around the fundamentals that doesn't play. You know, there's so much conversation and effort trying to, particularly in Medicare, to try to innovate. And within the space of just executing well and how you execute, I think there's a whole category of innovation there that's really relevant. You know, for the plan I'm with, Blue Cross Blue Shield in Michigan, we're a relatively large plan. We've got about 600,000 MA members, and so that creates a lot of opportunities to think about how can we customize and personalize things for folks. And that sounds like it makes sense, but the fundamentals, the essence of how do you actually do that is actually really hard. And anyone who's spent much time trying to really run an organization, a large organization, trying to do that, looking at data, technology, processes, healthcare data in general, very difficult to do. You know, what we've done is try to really look at specific kind of examples or use cases where we can bring some of that to life and create more personalized experiences for folks. That's how you're going to really get them to be more engaged, kind of do some of the things that we all want to encourage folks to do, those right things for their health and their healthcare. So, you know, an example I think I'd highlight would be one that we have worked on quite a bit. We call our monthly member digest. And that's really an opportunity for us to try to say, you know, what's the relevant information for folks and how do we get it to them at the time that they really need it? You know, healthcare is so complicated in many ways. The system is for folks to understand, and it's not something they want to understand. And so they easily feel overwhelmed, especially our seniors. And so when you think about even outside of the kind of major health events, you know, what do we want them to know and do to stay healthy? You know, we take that really seriously. We look at like, how do we get people to the right providers, you know, that they have access to? How do we encourage the right types of behaviors, motivate them? How do we support them in their chronic illnesses? So finding that relevant, helpful way, personalization, customization of information is really critical to doing that.
How do you do that? You know, I find it freaky, but sometimes pretty impressive when I'm on Amazon and they're putting things in front of me that, you know, I know that I'm almost there to need, or if I wasn't going there specifically to shop for that, I do need that item. So they're pretty good at like knowing what's up before even I am. How are you as a health plan able to customize and personalize your content?
Yeah, and, Amazon, Netflix, there's a lot of folks to look at there that can be, you know, I think aspirational in many ways for us, for people in the healthcare industry. One of the things we do that is really dig into, we leverage the data we have to try to segment people. And we've got a segmentation based on common attitudes and behaviors, where we've taken advanced analytics and looked at how are people behaving, how do we group them together, what are their attitudes toward healthcare, toward what's their financial situation, what's their, you know, any data that we have that we can to kind of start to be more relevant in the conversations that we have with them. And then, you know, let me give you some examples of, you know, in that monthly digest I mentioned, you know, people may be eligible for something new in their drug plan, or they may have a new incentive program they're eligible for. They may have not registered to engage with us digitally. We take all of that data, and in something like that monthly digest, we actually have content blocks that we can put in there and really create more of a kind of a custom experience for the member based on that data that we know about them and that segmentation that they have. So really leveraging kind of the information and the power of communicating digitally to make it more relevant.
Nice. Just, I know a lot of people are joining us a little bit tardy. I won't penalize you, but I will repeat for your benefit. If you want to help co-moderate and throw questions to our experts, follow-up questions, use the Q&A module, we'll be monitoring it. So Nathan, CEO, Linkwell Health, let's bring you in. I mean, to that end, and to what everything just like Bob just said, are there traditional marketing vehicles from outside of healthcare that we should be using more?
Great question. Thanks. I agree with much of what Bob said. I think there are best practices from outside of healthcare that can easily be leveraged to better engage, particularly seniors. And I think one of the perceptions that exists out there is that seniors aren't particularly digitally savvy or tech savvy, and that's there's a lot of plans who are growing to see that that's fundamentally inaccurate. But I haven't seen them leveraging best practices from outside healthcare to truly take advantage of that. I mean, something like 60 to 70% of seniors have a smartphone. 95+% of them have access to the internet. And one of the key ones is almost 90% of seniors are accessing social media on a daily basis. There's not just Facebook, though it is one of the fastest growing audiences on Facebook. Instagram and TikTok have huge senior communities, and some of them are awesome if you've never checked them out. There's seniors are spending just a huge amount of time on the internet, consuming a huge amount of content. So delivering relevant content to people in the right channel at the right time digitally, I think it is a huge one. And using that, as Bob said, on a more personalized way to get the right message to them at the right time can build just much stronger relationships with those seniors. So serving them with information, I think, is key. Our experience with our health plan partners, there's just a huge amount of transactional communications, right? People are asking members to do a lot of things. Ultimately, it's a lot of siloed communications where different divisions, different departments need a member to do something. So as a result, they're sending out a communication, transactional, do this, get an annual wellness visit, get a flu shot, whatever it is. The approach that we take to engaging seniors that we've really leveraged from the best of consumer media and content marketing organizations and brought specifically into the payer vertical is to serve people with great information and then build that relationship, build trust, and then ask them to do that next step, the next best action that we need them to do. So, for example, Bob brought this up, so I'll go there with it, but editorial email newsletters. So not just transactional email newsletters, but or emails, a newsletter that can get awesome content in front of members that actually makes them want to hear from you, want to hear from their health plan. And then inside of that content, you can serve relevant and contextual calls to action to push them along in their journey. So rather than just telling someone it's time for an annual
follow-up. Do you mind if I ask you? Because you said,
yeah,
you
sure.
said something that struck me, want to hear from your health plan. Okay, so that's an interesting challenge right there. Do you have an example? Do you have an example, whether directly with a health plan or a health plan partner, where you could illustrate an audience want to hear from their health plan?
Well, we have a bunch of examples. We have one of our Blues customers.
I was thinking specifically, by the way, just to tee you up, I don't want to catch you. I was thinking specifically when we were talking prior to the show about the sneaker one.
Yeah. So Silver Sneakers is a great example. So Silver Sneakers is a long-term partner of ours. We've built really a large consumer marketing, content marketing operation for them. And one of the big ways that they have engaged with their eligibles or potential eligibles, people who may not have Silver Sneakers today, but may want to pick a plan that does, is through serving great content on multiple channels. And one of the key ways that they engage is through an email newsletter. So they're also using that content to engage health plan members via the plans as well. So we have a number of email programs where open rates are cresting 30%, which is really strong. I mean, I think, email open rates across various industries are sometimes 10 to 20%, depending upon the industry and otherwise.
Lower.
Yeah.
Well, I would ask
editorial newsletters. So when you're delivering great content that actually puts the member at the center of the communications, I think that's key. Like it takes a nurture approach to marketing, and that's really where content delivered digitally can play, particularly with seniors. Like you're not going to always convert someone on first touch. I mean, back to your original question, you asked other sort of best practices from outside of healthcare. It's a multi-touch approach, and content can be what guides people through those multiple touches. And each time you have an opportunity to surprise and delight, and also serve people with information that can improve their life first. And then you earn the right, once you've built that trust and given them relevant and contextual information, to ask them to take the next best step in their journey. So I think that one's really key as well.
Okay, I want to summarize what you just said, that, and if I may, I just want to, for the audience, one of the reasons, let's say the silver sneaker example has been so effective, multi-touch.
Yep.
You didn't say this word, and we're going to cover it later on, but like really taking the consumer point of view.
Yes.
And then you mentioned a nurture approach. Could you just define what you mean by that for everyone?
Well, nurture marketing is much less about buy this now. Nurture marketing is about guiding people through the consumer journey, through the funnel. So from awareness to consideration to purchase in the healthcare sense can be deciding to engage with a care manager or to get an annual wellness visit or a flu shot or a COVID vaccine or whatever it might be. So nurturing people along in their journey and giving them ways to engage where and when they want to, as opposed to kind of hammering them with a, I need you to do this message. Because inside of health plans, there's like 20 people who need you to do something today. And if they're all shouting at you at the same time, it's much less likely that you're going to engage with one, if any of those opportunities, as opposed to being guided into those next steps, being nudged along.
Great stuff. Let's shift a little bit, get another perspective. There's this very little known organization in Baltimore called Johns Hopkins. You could Google them, and they actually have a health plan as well. And we're lucky enough to have their chief medical officer, Marketa Wills, with us today. Marketa, welcome to the show. How is Johns Hopkins Healthcare applying traditional marketing to engage Medicare members?
Hey there, thanks for that question, Eric, and thanks so much for allowing me to be a part of this very esteemed panel. So we are working really hard at traditional marketing and trying to really understand what it is that our Medicare Advantage members want. And so we surveyed them. We surveyed the readership of our newsletter to really try to uncover any insights that we could about what's the best way to reach them. In that survey, we found that direct mail still stands out as the most effective way to connect with our members. But as my other co-panelists have mentioned, the digital approach is a close second. And, I think that's really important for people to understand in our senior communities. And so we provide our newsletter both in print and online modalities for that reason, to be able to meet each individual beneficiary where he or she is with the kind of information that he or she needs. We also, during that survey, found that about 94% of members say that as a result of reading those letters, it really does inspire them to take better care of their health. So the content that we're feeding them is doing just what my co-panelists have said, nurturing and inspiring and empowering them to take those next actions. And that they also, either they or their family members, 77% of those reported that it changes the way that they do business with regards to their health by reading our publication. And so we take a really, really careful, responsible look every month about what information needs to be curated and tailored for our members to be able to continue on their healthcare journeys. So echoing a lot of what my colleagues have said, they also feel that through the survey that we as a plan actually care about them. And 93 of our respondents who read that say that. So it builds that relationship, it builds that stickiness so that the next time the inbox email comes, they're more willing to read that and engage with the content in a proactive way. I think another piece to that is we are a provider-led plan. And so having the opportunity to partner with our providers in exciting them about our brand promise, our brand offering is something that we're positioned to do in our market. And so that, I think, takes us a long way as well.
You mentioned some statistics. 77% of family members have changed the way they take care of themselves based upon the publication was one of them you threw out. I guess I'm going to ask the group quickly before we leave the newsletter topic. I'm surprised how much we're around the newsletter. It's actually really interesting because I do think in many ways effective pragmaticism is innovation in healthcare, and we sometimes get away from that. So this is all really good. But we have a question from an audience member around beyond open rates as a KPI. What is a measurable goal around your newsletter? So what would be viewed as success, whether it be clicking on a referral to a service, or is it taking a flu shot that was mentioned? And what is a good number to aim for? Is it 100%, 30%, 1%? So I'm wondering if anyone could take that. I'll start with you, Nathan, if you have a thought on that, and then maybe Bob or Marketa, you could jump right in.
Sure. So if you have open rates that are maybe in the 30% or otherwise, and that's single channel, so not taking into account that you may also have a print companion for that, or that you may have a social media strategy for that, or a SMS strategy or something else. But if you're just looking at single channel open rates of maybe 30% on an email, within that singular email, depending upon what you're asking members to do, sometimes if it's to log into the portal, it's far different than to get an annual wellness visit or get a flu shot or otherwise. So you have to think about sort of the level of ask and the level of effort on the other end of that ask. In that single touch, we see anywhere from 5 to 25% conversions, depending upon what we're asking. But that's only on a single touch, and that's within a single piece of content. So if you have open rates of 30%, but you have people coming in and engaging with multiple pieces of content, and you can serve them with dynamic calls to action. So we do a lot of programs that are personalized. And so that would allow for a different call to action to be served for me than for Bob, because if I've already had my flu shot and I know that about that member, I'm going to be served with a different call to action. Maybe it's COVID vaccine, or maybe it's engage in care management. So, when you take a multi-touch approach, though, like we have one program with a large national carrier that's all around activating people into care management, and a lot of it's an email program. After every touch we have with a member, calls to care managers bump by 10%. So 10%, it's a pretty good number. It's not epic, but think about all the touches across the year. If you have a dynamic publishing rhythm and you're really serving people in multiple channels with great content all the time, the compounding effect of each of those bumps goes up pretty dramatically to where you start reaching and actually converting a large number of that population.
Well said, Professor.
Yeah, Nathan, I really like how you describe it. It's that multi-touch piece, because I think you want to be careful not to try to say this, whatever that newsletter content, don't evaluate it only on its own. It's going to be evaluated over the context of all the things it's trying to accomplish. It's that ongoing relationship you want to drive.
Awesome. Any final things to add before we move on? Let's switch gears to events. I'm going to bring in our favorite Kansas City Chiefs fan, Mo Jackson. She is the Medicare sales strategy manager at Blue KC. She was at an event Monday night. We won't talk about that one right now, but how is Blue KC driving better star ratings through local events right now?
Thanks for the question, Eric. So Blue Cross and Blue Shield of Kansas City has been pretty innovative in trying to get in front of people. And actually, well, I'll tell you, let me start backwards here. We have found that a lot of people don't even realize what they have in a health plan. They don't realize the supplemental benefits. They don't understand how everything works. And what we found is that they need a better connectivity with us, a method to ask questions, get answers, solve problems, without making it an appointment with a broker, or without having to come down to the plan to find this, or to call customer service. So what we've done is we actually have events. And one of those events that we're right in the middle of doing is what we call our annual Notice of Change Medicare in a Movie event. And that event is something that we started a few years ago, and it's kind of morphed. It's gone from sales meetings to now we do member meetings at these events, and one of those, the ANOCs, to actually go over the changes that they have from year over year. We also, in those meetings, we take time to explain all those extra supplemental benefits that they may have, and those drive good results for us. So they actually help us get better results from our membership by letting them know, hey, did you know you have this in your plan and you can use it in these ways? We get a lot of good questions, get a lot of good feedback. But what we also do is we have that meeting, and then after the meeting, we allow them to see a blockbuster movie. So it is a call to action. It drives good results. We have great attendance to these. We have waiting lists for these. By engaging with the members in a place that they're comfortable with, they can hear questions from other members that they may not have thought of, or I learned things myself. For example, one of our benefits allows for a company called Pop-Up Pals to give them 40 hours of service in their home for small tasks, right? So a member can engage with someone that is a companion or caregiver at no cost to them, 40 hours a year, and they'll come out and do small things for them. One of the things they told me yesterday that they utilize them for is if they have a trip to see their daughter or son out in Colorado, they have them take them to the airport. So they provide a lot of feedback and insights that I didn't even know. And so I can move those forward and help with better results for our membership.
Parents could have seen Top Gun and gotten all of their information and answers.
Yes, absolutely. And it's great feedback. It really is. And, again, it started as something simple and small, that we have people doing that. And another way that we help engage them with this is we actually we have a lot of brokers that are on our plans. So the brokers actually really push their members to come to these. So we engage the brokers to help drive members to come to meetings, to events, to help them better understand their benefit platform that they have available to them.
It's great. This is great. And I know we've had a large focus on sort of content and content marketing. Now we've got a little bit of events. I want to just, two things I want to do right now very quickly. First of all, I have a content piece I want to offer up to everyone that may be helpful, that may summarize a lot of these things. I did mention that with this great partner, Linkwell Health, now to the Bright Spots and Healthcare podcast. If you joined us late, they are a consumer engagement technology company that creates healthy experiences for consumers by guiding them to take actions to improve their health. You could see some of the brain power they have behind them, and Nathan being their CEO. I just want to give you a brief details about them, and then I'm going to offer you a content piece from them. They are seamlessly delivering via their technology platform in a very carefully designed way, health engagement, activations, retention, and results, as you hear from Nathan, to some of the largest health plans and health service providers in the country. Their proven approach establishes you, the health plan, the ACO, as thought leaders and authorities on health and wellness advice and information by delivering this customized content that means something to that targeted audience, those things that we talked about, like taking the consumer's point of view. And they do this with 3 guiding principles to drive results. And this is what always drove me to them when I heard about this. They focus on powerful storytelling. They know that every person's journey is different. And the third thing is they think people should love their healthcare, and they design their content and communications around that mission. So if you want to learn more about how they do what they do, but more importantly, in general, a blueprint on how to boost your own member engagement, even if you want to do it yourself, I'm going to offer you their guide. They have a guide called 5 Content Marketing Secrets that healthcare marketers can't afford to ignore. It focuses on 5 key strategies on how to deeply engage folks in your digital content. It educates, inspires, and empowers consumers to take action. I read it. It's about a 10-minute read, maybe a little bit less. They cover journey mapping, authenticity, content marketing, online search, and just overall organizational agility. So Sherry Keel just put up that poll. We'll email it to you, so you don't have to sign up for anything. We'll email it to you directly after the show if you want a copy of it. It's worth a quick perusal. And if you want to learn more about Linkwell Health, check them out at linkwellhealth.com. Incidentally, in about 15 minutes, I'm going to send you guys a feedback survey on how like we did today. And you absolutely could request an introduction to Nathan and his colleagues at Linkwell, just to pick their brain, not even to like do any business with them necessarily, learn from their expertise. Happy to make that introduction. I won't just hand you over their name to you. I will actually email you a warm introduction. Okay, let's get back into the conversation. I'm going to bring in Dr. Wills, CMO at Johns Hopkins Healthcare back in. A lot of what we're talking about, Marketa, requires organizations to have this consumer centricity view, a culture as foundation to their organization and everything that they do at the organization. So how are you at Johns Hopkins Healthcare, you're provider-led, sometimes provider-led, you have a provider perspective. How do you truly take a consumer-centric approach to everything you're doing?
Yeah, thanks for that question. Honestly, it really is about a culture shift and a culture change throughout our organization, really allowing every associate in our organization to think fully about customer experience and build in that customer centricity mindset. So helping people with empathy training, making sure that they're understanding when folks call in that there might be an apparent problem, but often there's a latent problem in there too, and allowing them the tools and skills to be able to uncover and unleash those. I think another thing that we
Marketa, what is empathy training? Because that seems to be a big secret sauce you just mentioned. And do you outsource that? Do you do it internally? What does that entail?
Thank you for that question. It is something that we are currently in development on, working with all of our frontline staff. It's interactive. It's taking modules to be able to understand how would you answer tough questions? How do you regulate your own emotionality as you're having what can oftentimes be very charged interactions, because people's health is very serious to them when they're calling in about claims, finances. Those are things that really tap into our own sense of self and sense of well-being. And so giving our frontline staff who interact with customers opportunities to really think, about what they're doing in those interactions so that they can put themselves in the mind of the customer through role playing, through defined teams around different populations, such as sexual orientation and gender identity, making sure that people learn language and are sensitive to the needs that our members may face in their healthcare journey. And so our member-facing staff are the first staff up for this. So the empathy training, customer service, as well as complaints and grievances. So it's less about escalation and more about that, again, nurturing mindset, helping partner through the healthcare journey with them. And we learned that this was important by asking our members. This year, we launched member advisory councils for our Medicare Advantage business line. And that's where we learn that having personable, relatable, informed, empowered concierge service was important to our members to help them navigate that. I think one of my other panelists mentioned that oftentimes, I think that was Mo, oftentimes the insurance industry is really complicated, really confusing, and having that concierge advocacy mindset. But again, it's empathy that drives those trust-based relationships that we aspire towards for our members. So that's some of the things that we're doing here at JHHC that we're really excited about building out. We have a new Chief Operating Officer, Ryan O'Donnell, who is our member experience kind of executive champion. And of course, I sit on that council as well to drive insights from our members and make sure that everyone within our organization puts the member first.
That's great. And Bob, you mentioned a lot about how you're customizing your content. I think that obviously to have your health plan, you have to be focused on consumer centricity also. I guess everyone does, but to deliver everything that you've outlined as far as personas and segmentation, how has Blue Cross Blue Shield of Michigan become a consumer-centric organization?
Yeah, that's a big question. It's one I love to talk about. There's so much that we've done. I'll hit just a couple things here to kind of give a little insight. This is something we've been focused on for years now, and we really view it as a core part of who we are and what we're doing and how we truly help our members be more healthy, and our customers really manage the care. So it's something that we realize, and building on what Dr. Wills was saying, you've got to enable the frontline staff, but it's also as much the rest of the organization, the people who are working on those processes and procedures and all of that every day, that if they're not thinking about the impact of what they're doing on the actual member at the end of the day, or the rep who's dealing with the member, the person who's dealing with the member, then you've really, that's where customer centricity happens, is delivery, but also all that kind of stuff that happens up front. We're fortunate to have a CEO and senior leadership team that has really espoused and understood the value and reinforced the importance of this for us. And so I would say it's a strong kind of cultural view in our organization that we need to be doing things through the lens of our customer, of our members. And, it actually kind of gets back to, I was talking earlier around kind of some of the fundamentals, get them right. A few of the things that we try to carry through into the work we do is, one, make healthcare more clear and simple. And to the point around how complex it is, we've got an enterprise plain language initiative going on. We went out and actually looked at, we took some actual existing materials and looked at how we referred to an annual wellness visit. And we found it was referred to in nine different ways. And you think you know what that means, but there's nuances, right, between what different visits mean. There's that one-time Medicare visit, there's all these different ones. And so really stepping back and thinking about, how do we take all this information and redo it in a way that makes sense to the member? So we've got an initiative to try to really look at all of that across our organization from that member's view. And that second one I would mention is that member view, really taking, if you're going to do an engagement with a member, look at it from the member's perspective. And you mentioned that earlier, Eric, and I think that's really important, because any program you have, that all these kind of places in the organization that are trying to help the member do these specific things, reach out or whatever. But if the members just had a health event, they probably don't need to be getting contacted by the wellness area just yet. They need more help kind of in the recovery and kind of getting back to, so there's different outreaches that you've got to really understand when's the right time to give to them. So if you look at, or they may be dealing with a spouse event, right? Something else that is not more readily available to us. And so understanding those kinds of things really helps any type of engagement make more sense. And the third one I referenced earlier, which was just leverage the data we have around people to really bring it to life. So those, I like to kind of point to those fundamentals, but we try to layer a lot of that and other things into the organization and throughout the organization, so that when it gets to the customer or gets to the member, it all makes sense and it just works.
How do you identify, how do you sort of identify for a particular persona, who are the people or stakeholders in their healthcare lives that are going to influence them to action, and identify them and then leverage those stakeholders to execute on a call to action?
I'll tell you, I'll give you an example that'll I think will kind of bring that to life. So we've partnered with an organization to launch what we call dedicated senior medical centers. And this is all around meeting members where they are. And in this case, it's in their local communities with local clinics. It's specifically focused on serving low to moderate income seniors and who often don't have access to high quality care. And so partnering with someone like that, understanding the need and, with our customers, finding the right partnership, setting up incentives alignment in a way that really has us all focused on the same thing, and then reaching out to them in ways that make sense. And so, like we talked about segmentation. So in this particular case with Dedicated, we wanted to get people to come understand what was now available in their community for them, right? And so we partnered with them, did open house events. We went and really tried to communicate pretty aggressively. Email, we talked about multi-touch, right? Email, direct mail. We had some social media stuff going on, different things in the community to kind of really drive up awareness, but we wanted to get visits there too. And so these on-site kind of visits for people to come in and actually learn a lot more. When we reached out to people, we looked at things like, okay, from our segmentation, we know some of these folks they have challenges with needing assistance, or they're struggling with their chronic condition. For them, we focus the messaging and the language around, hey, this is how you can get support and get your clinical needs met. For some people who we identified as kind of like, they're no nonsense, independent, they're kind of savvy, they're healthy starters. For them, it's all about convenience, right? Like it's right here in your neighborhood. Come by, take a look, come talk to people. And then we've got some folks who are more like, they're very engaged and they're trying to manage their whole health. So for them, we talked about prioritizing their clinical needs and those sorts of things. So we really kind of customize what we know and how we reach out to people, try to partner with partners who can help us create that holistic kind of situation for the member from their perspective to address what their underlying needs are.
Great. I want to, I know we're running a little bit behind on time, so I want to make sure, quick little PSA to my panel. I want to rip through some of these questions and get some folks, so we can share some examples. There's some good questions from the panel, from the audience. There was one in particular I wanted to take. While I'm doing that, I want to let you guys quickly know who are watching live via Zoom. Next Thursday, we're covering a topic called co-designing social care between payers and providers. And then the week after that, we're covering hybrid care and transforming value-based care through hybrid care. If you want to save yourself time through and not fill out the registration form, we could register for you. So we'll put up a quick poll. If you guys want us to register for you for one or both of those events, let us know, and we'll take care of it for you. So as far as, let me just grab this question, just the window goes down. Are payers, sorry guys, I don't see that question there right now. Oh yeah, here we are. Can you share a recent experience where you engaged Medicare Advantage members using mobile apps to improve their health and engagement? What app, and provide maybe an example, what apps were used? Nathan, could you take that?
Definitely. We actually recently announced a really interesting partnership that does exactly that. So it's called Well Squared. It's a partnership between Linkwell Health and WellFrame. For anyone who's not familiar with WellFrame, I know both Michigan and Kansas City certainly are. It's an amazing app that allows health plans to engage with members, particularly around care management and advocacy. The biggest problem that apps in general for health plans have is marketing them, right? Getting people to actually utilize them. So what Well Squared is doing is building omni-channel marketing campaigns, like the bread and butter relationship building between members and Medicare members, as well as commercial and ACA and otherwise. Building a relationship with members and engaging them with content, and then activating them into utilizing these apps. Once people are in WellFrame's app, it's super powerful. Like, it allows care managers to engage people. It allows advocates to engage people on multiple channels, multiple modalities, whether that's chatting back and forth, calling, passing them off to customer service or something else. And a lot of what it's doing is, I think what Bob just hit, it's really helping to explain the benefits that are available to you, explain why you should use them and how to use them, and then activating people to take the next step. So we see apps as a super powerful part of the healthcare ecosystem. We've had successes with others as well, but the key part is actually getting people into them and then getting them back into them. Like the re-engagement is the key. So for the Well Squared partnership, we're super excited about that because we've seen the power of WellFrame, and we know that we can do the kind of upper funnel and getting people into that. And so together, Well Squared really creates like a cohesive ecosystem for members to engage when and where they want to and how they want to through the modality that they want to.
It's great. Thank you for sharing that. I wanted, Nathan, to ask you about, we've been talking about consumer centricity. How do you focus, like what would you advise everyone in the audience when you're thinking about content creation and content communications? How do you apply consumer centricity into your content in a way that maybe folks aren't thinking about? You've probably got a lot of people and engagement in the audience right now. What maybe they're not thinking about that they could add to their content strategy?
Well, the type of content that we create is called service journalism. Service journalism was built many of the biggest media brands in the world, but a lot of people don't know what it is. So service journalism gives you not just the what, like there's so much what in healthcare out there. Like WebMD is more than happy to tell you what diabetes is with a free Google search and then sell you some advertisements around that. Service journalism really gives you the how and the why. It puts the member in the center of the story, and it takes complex information. Like several panelists have hit this. Healthcare is complicated. It's deeply personal and it's hard to understand. So it puts the reader in the center of the story, and it breaks down complex medical information, complex healthcare information, the latest studies, research from experts. And rather than just repeating that to members, it gives them tips and tricks and chunks and easy ways for them to see themselves doing that thing. So rather than telling you what diabetes is, like I said before, it gives you the how and the why. How can you take action on this to improve your life today? And why should you care? And then if you use that style of journalism and integrate relevant and contextual calls to action, you're not only informing, empowering, and inspiring people, but you're also giving them a way to take that next step in their journey. So our team comes out of some of the largest consumer media brands in the world. Like our chief content officer was the global editor-in-chief at Men's Health. We have several former editors-in-chief of some really significant healthcare media brands. And instead of using content that's so good people want to pick it up at the newsstand or subscribe to it and actually pay for that, and then have advertisers paying hundreds of thousands of dollars to wind up amidst the pages, we're using that same quality and style of content, but to serve members to improve their lives, and then to ask them to engage and nudge them along in their journey. So I think taking a service, like really member-centric approach, is the number one thing that we would recommend. And whether you're doing that with us or doing that yourselves, like you have to put the reader right at the center of every story. It has to be about them. You and your are two of the most powerful words that we have when we're building our content programs, because it's not just about what the health plan needs their members to do. It's about you, the member, and taking that action if aligned correctly. And if you've built the right content strategy, you're giving them information that improves their life while solving your business problems or achieving your business goals. So I think that's the special sauce.
Learn something every day. Mo, I know sometimes when companies get really innovative in their approach, there's sometimes this loss of the human touch, and that could impact CAPS or just even basic NPS, which obviously correlates to CAPS. How are you guys at Blue KC combining the human touch of your brokers along with technology to drive better engagement?
So thanks for the question, but I want you to elaborate a little bit more on what you're asking me, because I want to be sure that we have talked about this. So
yeah, I mean, I was thinking about what you were, when you started talking to me about your ambassador program. And
yeah, the Blue Ambassador program. I thought that's where you were going, but I wanted to make sure. So we actually, and I'm sure almost every health plan probably does something similar to this, but we actually learn that we can learn a lot from just taking time to listen to the consumers and making them feel involved and giving them the power to feed information back to us. So we started a program called Blue Ambassadors, and that's where we just send out requests for people to be on this panel, our membership, and to give us feedback in regards to how they want to use their health plan. How do they want to use their health benefits? What can they do with this? And invite them in and do events with them. So we'll do a cash bar, have them come in and give us feedback, make sure that they can have the important things in their lives known to us. So giving them the opportunity to give us feedback is important. So we started that program. We do this. We've done it for years now. It's a great way for us to get feedback. And we actually introduced this because, as I said before, a lot of our age population brokers are in our plan. We actually use them as a tool to make sure that the message gets out. And we want people to be engaged with us. So we utilize that relationship to drive results with us. And it has shown we've grown a lot, grown a ton just by taking that information and evolving that into a plan that is more member centric and what they want, as opposed to us trying to figure out what they want. We just take the feedback and involve them.
Great. And so I want to do a couple of things. So we're really tight on time here, and I want to get to these questions from the audience. I see Marketa, you're potentially typing one answer. Let me know if our panel is going to take those last two questions that just got posted up there from John and Taylor. I'm going to keep on going because I want to go around the horn here, around the table, and share as many different examples of bright spots around engagement, activation. It could be tied to general activation to a call to action. It could be tied to star ratings or caps. It could any of the above. No restrictions here. Let's start with Bob, and then we'll go over to Nathan. We'll see how much time we have after that. So go ahead, Bob. Let's share some bright spots quickly for the audience.
Yeah, real quick. Okay, here's one goes back a little bit to multi-year effort, and it has to do with caps. We're looking at an overall drug plan rating. It was we were 1 star, and we really dug in to try to figure out what's the problem here and what do we need to address. And when we looked at it from the provider's perspective, the pharmacist's perspective, the member's perspective, we realized it really goes back to an informed conversation between the doctor and the patient in the very beginning. We put together this RX savings guide that has it's personalized content, not high level. It's very specific. Your drugs cost this. You need to ask these questions to your doctor, very kind of specific. And we went from a 1 star to a 4 star over a period of a few years with a lot of hard work. So it's a great example, I think, of personalization and really understanding it from the member's perspective.
What about you, Nathan?
We have one awesome case around the largest Medicare Advantage plan in Puerto Rico. So when we first engaged with them about 2 years ago, they were really struggling reaching members with content and outreach. They had a lot of programs, actually to a lot of what Mo's talked about, some awesome like in-person programs and otherwise, but they didn't have like that consistent trust building engagement relationship where they could reach members where they were. And so we really started building this consumer engagement strategy that was to impact not only NPS and member satisfaction, and there was a bunch of star ratings associated with that, but it was also to help highlight specific benefits available. Like they have this amazing benefit, the health plan owns cars and they will deliver your OTC medication within 24 hours at a discount to you. Like they'll show up at your house on Puerto Rico, and it's a place for members to engage, right? So that driver's not only delivering OTC medications, but it's a place for them to understand, are you suffering from other social determinants of health or otherwise? Part of the issue generally in Puerto Rico is they're getting a lot of just like sort of general Spanish generic content as opposed to super culturally relevant and personalized content in Puerto Rican Spanish. So we have a Spanish language team. It happens that the woman who leads that on our team is a Puerto Rican American journalist. And so we started building really culturally relevant content. Think about all the things that are going on in Puerto Rico, hurricanes, natural disasters, otherwise, and reaching members in channels like super mobile first, almost no desktop. So delivering content in a mobile first way to engage people and then to nudge them along into calls to action that were super relevant. So we've seen some awesome results out of that. One of the most interesting ones is time on site or time on page. So we had articles where people were spending more than 8 minutes with them, which is a lot. And these weren't super long form articles. And the interesting part is that the most clicked call to action in those articles was the final one at the bottom of the article. So it not only shows us that people were engaging for a long time, but they were converting. And the conversion rate on several of the key KPIs in that program was like 17%. So of the people that we were reaching, like 17% who touched our content were converting into the core KPI of that program. And that's like 4 times what we see in a lot of our other programs. It was super fascinating. The last piece of bright spot that I'll add is we reached about 37% of all Medicare eligible seniors in Puerto Rico through that program. So roughly 37% of the entire population, not that health plan's population, but all population through that. So from an acquisition and like brand building perspective, it was super interesting, even though the program was predominantly driving member goals. So it was really successful.
That's great. That's great. Marketa, we have a few more minutes. Do you have anything at Johns Hopkins you want to share? And incidentally, folks, I just, I'm a little bit biased because sort of in promoting and building the show, I'm in marketing and engaging all of you who are listening. So I'm finding this incredibly interesting, but it's most important that you are. So, that feedback form that now is in your inbox from me, please take the time to fill it out. It takes about 3 to 4 minutes, and I'll continue emailing you if you don't, and you've gotten enough emails from me the last 2 weeks. So thanks in advance for doing that. Go ahead, Marketa. Anything to share from Johns Hopkins?
Yes, I'd love to share about a new plasma screen initiative that we are working through with our provider partners, where in the waiting room of our providers, we are splashing health actions, ideas about co-pays, benefits, etc., and really building upon that trusted relationship with the providers to begin to push out some of our content so that they can link that experience back to their health plan while they're there. Those are vulnerable moments. We all have very deep personal relationships with our providers. And again, I think I touched on this a little bit earlier, leveraging that and using new splashy plasma screen content that otherwise wasn't in providers' offices to be able to share important details about the plan.
That's great. I'm looking at the time here. Any last minute bright spots does anyone else want to share in the last 2-3 minutes we have? Nathan, are you?
Yeah, I'm happy to share one. I was going to see if anyone else had one they wanted to share. I think one of the other areas that that shouldn't be missed as a section of how to reach today's seniors are, we already talked about, like, they're way more tech savvy and digitally engaged than ever. But I also think the pandemic really pivoted a lot of people's kind of view of health generally, right? Like the last 2.5 years, we've talked a lot about health, polarizing parts of health. Regardless and aside, people are becoming more proactive. And if you give them the right entry point to engage with you, and then guide them along, I think it just opens up so many interesting opportunities to not only, again, I said this before, like not only improve their satisfaction and whatever, but truly build a long-term relationship with them. Like, Bob and Mo, specifically your marketers, how expensive it is to acquire members, particularly in Medicare. It's about keeping them and managing their outcomes, because the beauty of particularly Advantage Medicare outcomes are the goal, right? It's about managing people to become healthier and managing that cost of care. So if you can first form a relationship and build trust with them and get them to engage where they want to, you start to see that happening. So we have like a large dual program where we've been able to reach really chronically ill, hard to reach members on a variety of different channels, and using, I know print newsletters we talked about before can be really effective, like using print newsletters to activate people into digital, and then giving a much more real-time personalized communication approach. So print newsletters have to, by default, be fairly generic, right? It has to give a wide, broad, you can't have 100 versions of print newsletters. It's too complicated and too costly. But if you give a more generic health and wellness, like trust building newsletter, and then give people an opportunity to activate digitally, then you get to deliver that more communication stream that's personalized and built for that specific member. We've seen just some amazing results reaching people who they had super hard time engaging with in other channels. And once you start serving that personalized flow, people feel like you're there for them, not just there for you, not just there for what you need them to do. So I think that's another great thing to think about.
Good way to end things. Thank you to all four of you for taking the time to prepare and participate in this episode. Really appreciate it. I know you're really busy, and so the time you took, just generally gratitude from all of us at Shared Purpose Connect. And always to the folks that are listening, I hope this was an hour of time well spent. I really appreciate your attention and your ongoing support of the show. As I always like ending, this is not just our podcast, but this is your Bright Spots in Healthcare podcast. So have a great day, everyone. Appreciate it. Take care now.
Thanks, Sarah.
Thank you.